Hello, lovely people. Good morning, good afternoon, good evening to you according to your time. You're welcome back to my channel. Thank you for your support. Thank you for your love. Thank you for your likes. Thank you for your dislikes. Thank you for the comment. Thank you for your support. Thank you for the subscriptions. I appreciate you all. Like, I really, really do. I love you guys so, so much. And you're welcome back to my channel. If this is your first time of tuning into my channel, don't forget to subscribe and turn on the notification bell so as to be notified each time I post a new video. And as you are already my subscribers, do me a favor, give this video a thumbs up if you like it, and if you don't, give it a thumbs down. But don't forget to always drop your comment. Don't forget to share to your loved ones, okay? And right now, over to why we are here today. The Nigeria reports 284 more COVID-19 cases, total infections in Nigeria. Yeah, new confirmed cases. That's what I'm bringing up to you guys. So the total confirmed now is 6,677. The discharged ones from the hospital is 1,840. The deaths as of now is about 200. Just a picture to prove it. Nigeria reports 284 more COVID-19 cases. Total infections hit 6,677, like I said just now. Coronavirus cases in Nigeria increased further on Wednesday, with 284 cases reported by the country. Despite effort by authorities to flatten the curve of the pandemic, the new cases confirmed by specialists agency, the Nigeria Center for Disease Control on Twitter, took the country's total infections to 6,677, which I just said, out of which 1,840 have been discharged, with 200 losing their lives. Data from the NCDC show that the cases were spread across 12 states and the FCT, with Lagos accounting for the highest number of infections for the day with 199 cases. A further breakdown of the figures showed the Rivers had 26 new cases, Oyo State has 19 cases, FCT, Abuja, and Borno 8 cases each of them. The FCT has 8 and Borno State has 8. Oyo State, like I said before, 19, FCT, Abuja, and Borno 8 each. Plateau 7, Jigawa 6, Kano 5, Abia 2, and the Quartet of Ekiti, Delta, Kwara, and Taraba each recorded 1 cases. Like I said before, just a picture to prove. 284 new cases of COVID-19 in the whole of Nigeria. And over now, that's amounting to 6,677 cases of COVID-19 in Nigeria. Discharged ones, 1,840, like I just said. And the death, it's 200. Earlier on Wednesday, the Nigerian Medical Association in Zamfara State confirmed that 8 of its members have tested positive for COVID-19. Meanwhile, Bauchi State government announced the lifting of the ban on religious activities in the state, suggesting that parts of the country are now choosing to resume normal activities. More than 3,025 people worldwide have now died. 325,000 people worldwide have died from the novel coronavirus, 3/4 of them in Europe and the United States since it broke out in China in December, according to the AFP tally. The virus has killed 325 people, like I said before, 325,000 people, 232. 325,232 people in 196 countries, and infected 4,943,050 people. According to the tally based on official sources at 1,900 GMT Wednesday, of those infected, at least 1,827,200 are now considered recovered. The tally is using data collected by AFP from national authorities and information from the World Health Organization probably reflect only a fraction of the actual number of infections. Many countries are testing only symptomatic or the most serious cases. In the United States, 92,583 people have died, the highest figure for fatalities. The country has registered 1,539,633 cases and 289,392 people killed. The United Kingdom has the second worst death toll at an official 35,704 for 248,293 cases ahead of Italy, 32,330 deaths, and 227,364 cases, 227,364 cases. France has recorded 28,132 deaths and 181,575 cases, and Spain 27,888 deaths and 232,555 cases. France revised down its death toll on Tuesday after changing the way it recorded nursing home fatalities. Since 1900 GMT Tuesday, there have been 4,951 more deaths and 94,820 new cases registered worldwide. The United States registered the highest 24-hour death toll of 1,404 ahead of 1,179 for Brazil and 363 for the United Kingdom. Belgium has the highest death toll relative to population with 79 fatalities per 100,000 inhabitants ahead of Spain, 60. Italy and the United Kingdom both 53, and France 43. China, excluding Hong Kong and Macau, has to date declared 4,634 deaths and 82,965 cases. It has 78,244 recovered cases. Europe has a total of 169,674 deaths, have 1,944,258 cases. The United States and Canada have 98,674 deaths and 1,619,714 cases. Latin America and the Caribbean have 32,422 deaths and 583,045 cases. Asia has 12,941 deaths and 387,127 cases. The Middle East has 8,420 deaths and 306,715 cases. Africa has 2,973 deaths from 93,772 cases. And Oceania, 128 deaths from 8,426 cases. Corrections by national authorities or late publications of data mean the figures updated over the past 24 hours may not correspond exactly to the previous day's tallies. I'll be back with more news. Stay tuned. Of Scotland don't talk now say this lockdown measures they do according to this because of this novel coronavirus. You say it don't they bring about, don't they be like wetin dey create more harm than good. And good they be make am before, yes, it dey really necessary, yeah, but he call dey talk now say the thing now don dey create more harm than good. Wetin dem be say make e do good before na in their good the thing dey do, whether na bad call dey do. Watch the video.
In publishing this route map, we confront a fundamental issue. The lockdown restrictions have been absolutely necessary to mitigate the massive harm caused by the COVID-19 virus. However, the lockdown is creating harms of its own: loneliness and social isolation, deepening inequalities, and serious damage to our economy. None of us want it to last any longer than it has to. So today we are setting out the phases in which we will aim to ease lockdown and reduce the impact on all of us, individuals, families, communities and businesses. The steps we will take are by necessity gradual and incremental, and they must also be matched with rigorous ongoing monitoring of the virus. There is no completely risk-free way of lifting lockdown, but we must mitigate the risks as much as we can, and we must not at any stage act rashly or recklessly. For all our progress, this virus has not gone away. It continues to pose a significant threat to health, and if we move too quickly or without proper care, it could run out of control again very quickly. And the danger of a second wave later in the year is very real indeed. We mustn't forget any of that. At every stage, though, the biggest single factor in controlling the virus will be how well we all continue to observe public health advice. Continued high compliance with the restrictions that are in place at any time, together with hand washing, cough hygiene and physical distancing, will continue to be essential, as will wearing a face covering where appropriate. I'm sure that everyone watching will want to know what changes will be made as we move to phase one. But first, a word of caution. Not every phase one measure will necessarily be introduced immediately on the 28th of May. Some may be introduced a few days after that. And depending on the evidence, it is possible that some may have to be postponed, though I very much hope that won't be the case. But next week, when we have completed our formal review, we will make clear exactly what changes we are making and when, and ensure that detailed information is available for the public. However, let me set out now some of the likely changes in phase one. More outdoor activity will be permitted. You will be able to sit or sunbathe in parks and open areas, and you will be able to meet people from one other household, although initially in small numbers, while you are outside. This is a change that we hope will benefit everyone, but particularly those without gardens and people who live on their own. It is important to stress, though, that different households should remain 2 metres apart from each other. That is critical in ensuring that this change doesn't provide the virus with easy routes of transmission. And because of the much higher risk of indoor transmission, visiting inside each other's houses will not be permitted in phase one. Some non-contact outdoor leisure activities will be allowed to restart, such as golf, tennis, bowls and fishing, subject of course to appropriate hygiene and physical distancing. In addition, people will be able to travel, preferably by walking or cycling, to a location near their local community for recreation, although we are asking people where possible to stay within or close to their own local area. Waste and recycling services will resume, as will many outdoor businesses such as agriculture and forestry. The construction industry will be able to carefully implement steps 1 and 2 of its 6-step restart plan, which it has developed with us. However, let me be clear that there must be genuine partnership with trade unions. This can only be done if it is done safely. Other industries that are expected to resume in phase 2 will be permitted in the first phase to prepare workplaces for the safe return of workers and customers. We will no longer discourage takeaway and drive-through food outlets from reopening as long as they apply safe physical distancing. Outdoor retail outlets such as garden centres will be allowed to reopen. However, non-essential indoor shops and indoor cafes, restaurants and pubs must remain closed in this first phase. Some key community support services will resume. For example, face-to-face children's hearings will restart using physical distancing, and people at risk will have more contact with social work and support services. We are also planning a phased resumption of aspects of the criminal justice system. And we will carefully and gradually resume NHS services which were paused as a result of this crisis. I also want to remind people that as of now, you should contact your GP, NHS 24 or 999 if you need to. That message is really important. These phase 1 measures, most of which have an outdoor focus, are not in place yet, let me stress that, and they are dependent on us continuing to suppress the virus. They will also be monitored carefully as they do take effect. However, we view them as a proportionate and suitably cautious set of first steps, and I hope that they will bring some improvement to people's well-being and quality of life, start to get our economy moving again, and start to steer us safely towards.
Another watch am. Another news again, like another thing again with the bother my mind. Like I want to ask this question. It gets that time as at April now, first week of April or so thereabout. Then e get group of they say they be doctors of China people wey come Nigeria. They come talk now say they fit come help, that they come to come help the situation of the pandemic for the country. But right now as we just dey talk like this, so now they don dey find them. I don't know where they go. I don't know whether they still dey. Don't know whether they don go back. But some people now dey reason am say maybe people, because people wey allow them come in as at that period, because they don do say no more traveling. People wey allow them come in as at then know wetin these Chinese people dey do. Dem know wetin dem dey up to, but dem no wan talk. Also, the same Chinese people now wetin really thing wey make dem even come sef, wetin be the main thing wey dem come do, like wetin dem still dey do sef, dem never hear of dem. Una watch.
A chorus of questions heralded the arrival of the Chinese doctors in Nigeria on April the 9th, while the restriction of flights into the country was in force. Approval of their presence seemingly stamped by the Minister of Health, Dr. Osagie Ehanire, who received them in person at the Nnamdi Azikiwe International Airport, Abuja.
At the most difficult stage of China's fighting against COVID-19, we received support of all means from Nigeria. It's time for us to reciprocate the friendship and kindness.
But if that's the case, why the secrecy now on their whereabouts? That was one of the other contradictions highlighted by questions from the media at the briefing by the Presidential Task Force on COVID-19.
I'd like to know the whereabouts of the Chinese doctors. Yes. I'd like to know where they are now. Where are they operating from?
Well, I want to explain first of all that I think not all of them were doctors, and I think that I heard that there are some that are technicians, but they are staff of CCECC. The Ministry of Health is not their host, so we can't always explain what happened to them or where they are. There seems to be a lot of interest in these doctors, but they are the staff of the company, and I think they are on the company visa. So I'll be very happy if you don't ask me about where they are, because they're not really our guests.
Apparently, the Chinese team is made up of doctors, nurses, and laboratory technicians, who also had to undergo a 14-day quarantine period, after which their whereabouts are unknown, which begs the question, where are they now? The truth is, the Chinese doctors' whereabouts and what they're doing now is not really unknown. It's known by them and those who let them into the country, and the Ministry of Health's non-disclosure of their location merely stokes the flame of uncertainty that was needlessly ignited in the first place.
Welcome back. The AstraZeneca could begin supply of potential COVID-19 vaccine in September. A picture. The AstraZeneca has said it has the capacity of to manufacture 1 billion doses of the University of Oxford potential COVID-19 vaccine and plans to begin supplying it in September this year. The drugs giant also said it has already taken orders for at least 400 million doses of the coronavirus jab it is developing with the university. It intends to negotiate further deals on capacity to ensure the delivery of a globally accessible vaccine. Results from an early-stage clinical trial in southern England are expected shortly, it said. If those are successful, other trials will follow in a number of countries. It was announced earlier this week that plans are in place to roll out a COVID-19 vaccine to 30 million people in the UK by September. If trials are successful. Pascal Soriot, chief executive of AstraZeneca, said, "We need to defeat the virus together, or it will continue to inflict huge personal suffering and leave long-lasting economic and social scars in every country around the world. We are so proud to be collaborating with Oxford University to turn their groundbreaking work into a medicine that can be produced on a global scale. We would like to thank the US and UK government for their substantial support to accelerate the development and production of the vaccine. This vaccine quickly and widely available. The multinational pharmaceutical company added that it has received more than 1 billion naira, which is equivalently 820 million euro. $1 billion, which is equivalent to 820 million euro, from the U.S. Biomedical Advanced Research and Development Authority for the development, production and delivery of a vaccine starting in the autumn. The development program includes a Phase 3 clinical trial with 30,000 participants and a pediatric trial, it said. That is the news on that. Over to the next news. Stay tuned.
Coronavirus pandemic, it may become the norm. The only way out of it is a vaccine. Such potential drugs are being developed at Oxford University and London's Imperial College. The government is spending millions on vaccine research and production.
So far, the government has invested £47 million in the Oxford and Imperial vaccine programmes. But today, I can announce an additional £84 million of new government funding to help accelerate their work. But there are no certainties. In spite of the tireless efforts of our scientists, it is possible that we may never find a successful coronavirus vaccine.
The Oxford vaccine is already being tested on humans and animals. Lots of it is being manufactured. Because of the crisis, the process is being squeezed into 2 years. It normally takes at least 8. The new VMIC Centre will provide mass production, 70 million doses, enough for all of us. The government has given £93 million for the centre to open a year earlier than planned. Leading immunologist Robin Shattuck thinks COVID-19 is an easy target for vaccine researchers. Without any kind of vaccine, how are we going to have to adapt our lives?
We will just learn to be better at protecting vulnerable populations and better at treating the disease, because we're still, only a few months into understanding this virus, and there are a lot of valid treatments that are being tested. And I'm sure in a year's time, we'll know so much more about how to treat people that the kind of fatality rate will drop enormously.
The Ebola outbreak in Africa prompted scientists to develop and produce a vaccine fast. The SARS epidemic in Asia died out before the need for inoculation, but the search for a SARS vaccine is paying off now.
I believe we are in a better place because of the SARS epidemic, because a lot of work was started on the SARS vaccine. But the problem was that you need the disease to be around to make sure the vaccine is effective.
We've discovered there are thousands more volunteers waiting in the wings to test a new vaccine. In response to a plea from a government health research agency, 150 GPs in the southeast region alone have said they're willing to ask their patients to take part in extended trials. The UK is said to be leading the race for a coronavirus vaccine, but it's a race against time, not a competition. 100 or so organisations across the globe are cooperating in the research. Martin Brunt, Sky News, West Sussex.
You're welcome back from that break. Court sentences Dahiru to 26 years in jail. The Federal High Court in Yenagoa, the Bayelsa State capital, has sentenced Yunusa Dahiru to 26 years in prison after finding him guilty of child trafficking and other charges. After about 5 years, the court sentenced Dahiru on Thursday for trafficking a minor, Ese Oruru. Ese Oruru was taken from her home in Bayelsa on August 12, 2015 by Dahiru to Kano, where she was married to him and her name changed to Aisha. Having been converted to Islam, after months of outcry from her parents and human rights activists, as well as investigation by the police, she was returned to Bayelsa in March 2016, pregnant with a child. Ese Aero's alleged adoption court grants Yunusa Dahiru bail. On May 26, 2016 essay was delivered of a baby girl. Dahiru was later charged with child trafficking, child abuse, rape, kidnap, infringement on the right to religion, and holding a person against her will. However, the absence of a judge stalled his trial in the early stages, with the essay parents complaining of neglect from the government during his appearance in court. He pleaded not guilty to all the charges. A lawyer and the defense counsel team said that they believe it was a typical case of Romeo and Juliet and that they do not believe that Essay was 13 years old. He was later granted bail on March 21st, 2016. But now, I believe justice has finally taken its course on him after all the trying to bribe his way or trying to fight it. He has finally been charged to court, or let me say charged to jail for 26 years. Stay tuned for more updates. More videos. Alright guys, thank you for staying from the beginning of this video till now. I really appreciate you. I want to say a big thank you, a big God bless you to you. I thank you for your support. I thank you for everything, your love and your subscriptions. I want you guys to do more, please. That's what I'm begging you to share. Please share my videos. I love you guys and I know God loves you more. Don't forget to subscribe, turn on the notification button. Turn on the notification button so as you can be notified each time I post a new video, because you don't want to be my subscriber and you miss out of all the videos I post. And also do me a favor, like, give me a thumbs up on the video, and also comment, share, and I believe God will continue to do more great things in your life, more breakthrough in your life. So good morning, good afternoon, good evening, according to your time that I greeted you in the beginning of this video, and now I'm greeting you at the end of this video just to wish you well, safe journey. I wish you good night, I wish you good morning, and I wish you a wonderful day ahead. Peace.